I would now like to call upon Shree Keshvendra Kumar to the podium. Shree Keshvendra Kumar is the State Mission Director of National Health Mission Kerala, as well as the State Mission Director of the National Ayush Mission. The youngest in his batch to be accepted into the Indian Administrative Services in 2008, he is a dynamic leader with popular and noteworthy stints as Director of Higher Secondary Education in Kerala and as District Collector of Wayanad District before his current appointment. Shree Kumar has been at the helm of several social welfare measures in his career, especially targeted towards tribal populations. We request Shree Keshvendra Kumar to kindly address the Clairvoyance delegates.
Respected Director, it is Professor Salni Bharat. Dean, School of Health System Studies, it is Professor Anil Kumar. Sri Dr. Harish Nadkarni, CEO in a National Accreditation Board for Hospital and Healthcare Providers. Mr. Sarvamitra Sharma, Founder Chairman at Dainik Jagran Group. And my dear, I will say colleagues, because most of you will be working in health sector, either in government sector or private sector in future. So at first I would like to thank organizers to invite me for this wonderful workshop, Clairvoyance 2018, the Health Odyssey, and even this topic, engaging stakeholders through contemporary dialogue, is very much relevant and all, because as we know, health sector is a dynamic sector. The things which we are saying today, again tomorrow with changing times and all, again equations, parity, everything change. So I will just talk about some Kerala experiences which we had in past years and some general things and all. As all of you would know that Kerala, recent past, we had two major health challenges. One was Nipah outbreak and second was our unprecedented disaster, particularly floods, landslide and all which happened in Kerala in recent past. Nipah, I will say the outbreak, we were fortunate to detect it as early as possible, and this was also an example where government and private sector came together to identifying this thing and to take all the necessary action to control this epidemic. It was a doctor from a private hospital, Baby Memorial, who suspected that first index case to be of Nipah. Immediately Manipal sample was sent. It was informally confirmed from their side, but NIV Pune is the authority to confirm this type of virus, so again reconfirmation was taken from there. And after that, entire machinery geared up, Medical College Hospital, Calicut was made as a main point where all cases, affected cases will be treated. We made isolation facility, 100-bedded facility immediately there. That was also a good model of public-private support. Sufficient number of N95 mask, personal protection kit, everything was given there. Training to all the staff concerned, from doctors, paramedical staff, cleaning staff and all who were dealing with this thing. They were properly trained, they were given proper kits and all, personal protection kit and all. And I will say that it was managed in the best possible manner, given the facilities which were available and all. But those 2 months, I went to Calicut that time. Calicut, which is a very vibrant city and all, that was looking like that no one lives here, markets are almost closed, no one is seen on road, and that type of situation was there. And that was the time where airport people, security checking people, they will advise that if you are not doctor, you are not supposed to go to Calicut. That was the fear factor that time. But that was managed well. And that entire thing is properly being documented to circulate it to all the stakeholders so that lessons learned and all can be used in other places also. One big lesson was that infection control, and particularly government sector hospital, tertiary care and all, many times overcrowding happens, bystanders and all, for one patient, 3-4 bystanders coming and all. So those are the areas where we are working that this overcrowding and infection, hospital acquired infection, what type of steps can be taken. Second big learning for Kerala was this disaster time, our health preparedness and all. So there also, even our health team helped for many rescue operations also. Our health team members, they became the first respondent and all. and rescued people, even patients from hospitals and all which were flooded. And even after disaster, normally this lepto outbreak or dengue, all these sites, even our field workers, everyone worked in a very much team spirit to control that after disaster, casualties and disease, this thing is as low as possible. Kerala, we know that other indicators, if we see maternal and child health, MMR side, we are the lowest in country. And despite that, in past 2 years, as per our latest SRS data, we made a 25% decline from figure of 61, we came down to 46. There also, in partnership with Kerala Federation of Obstetricians, we are targeting figure of 30 by 20 MMR figure, and we were targeting 20 figure by 30, which now Government of India is saying that Kerala should be targeting single digit MMR figure, and also we are working on that. Once we are achieving our 30 figure by 20, certainly we will be working out to bring our MMR in single digit. Similarly, IMR also, we were stagnant on 13 IMR figure for a long time. After that, a significant decline. As per latest SRS, our IMR is 10. And practically, at present, our data shows that we should be anything in between 8 to 9. We are waiting for the next SRS. Then we have taken a step like Hridayam program, that each and every child where congenital heart disease is there, operation or any procedure is required and all, identifying them early and providing them treatment in government sector or in panel private hospital free of cost, so that there is no out-of-pocket expenditure for the parents. We leveraged Government of India side Rashtriya Bal Swasthya Karyakram and state government Arogya Kiran program for that. And these are the areas where we are taking private sector totally on board, training program and all. We ensure at least 25 to 40% participation of private sector doctors, private sector paramedical staff and others also. Communicable disease also, we are working for this TB elimination. Then leprosy side again, we are taking leprosy case detection campaign, and also these things, even all these states are doing in routine manner. Kerala system also, though our numbers are low, but if numbers are low, you have to take more effort to bring it further down. Then Kerala, if we talk about health challenge, certainly non-communicable disease is our area of challenge which is further emerging. As we know that diabetes side, we are having around 18 plus age group, 1/4 population is diabetic. Hypertension, if we see 18 plus age group, 1/3 of our population is having hypertension. Similarly, since diabetes and hypertension is there, so heart disease and other side also cases are increasing. Cancer is on rise. So these are the area of challenge where we are going to provide cath lab and other facility at district hospital level, dialysis center at taluk hospital level and all, and a lot of work from government funding, from other resources and all is going on. And similarly, geriatric care is another area where Kerala population is aging. So this is also one area where we have to take a lot of effort to ensure that each and every elderly person coming to hospital, he finds hospital friendly to him, ramp, then separate ward and all other things are provided to him, and these type of things. And Kerala government has taken one big initiative, Arthram, that is health sector transformation and making it patient friendly. So out of our 841 PSC, 170 PSC we targeted to make them family health center, guideline and all the manuals were prepared for that. And basically point was that PSC which were working till afternoon, they should be functional till evening 6 PM. And instead of 1 doctor, 3 doctors should be there, 4 staff nurse, then similarly paramedical staff and all sufficient number should be there. I think that is helping us a lot. Many people who couldn't afford private sector out of pocket expenditure, but they were forced to go to private sector since afternoon and all, they were not having option. They are returning to government sector, and we are seeing a significant increase in OP, particularly in primary healthcare level in government sector. So similarly, quality also, our CEO, National Board of Accreditation told about NABH journey and all. Initially, I think 5 or 6 hospitals in Kerala, government sector also we have gone for NABH. Now Health Ministry has come with National Quality Assurance Standard. So around 14 hospitals we got National Quality Accreditation in past year, and 2 hospitals, one our Taluk Hospital Chalkudi, which was devastated by floods very badly. Just before disaster, national team assessed that, and that scored highest mark in sub-district hospital level in country, that was 98% mark. And one of our family health center in Wayanad district, tribal family health center I will say, that scored highest mark in PHC level in country. So quality side also we are focusing that any patient coming to government facility should not feel that quality is lesser than any private facility. And target is that any patient which cannot afford private sector fee and other things, he must have good quality healthcare in government sector. So even Kerala side, another point that we are trying to leverage Ayush also. We are having a strong base of Ayurveda. So using that for NCD, prevention and promotive activity and all, we are working on a big way, even integrating yoga for many of the lifestyle diseases. That side work is going on. So basically Kerala system, though it is a robust health system, but still we are having our own challenges and all, and we are continuously working on that. Certainly this type of workshop and this thing, I will say that even this School of Health Science can evaluate this family health center in these type of models. Certainly an outsider evaluation giving a different perspective that what further changes are required will be good for a state. So I think that this will be a continuous convergence and cooperation from TIS and our Kerala side health sector also. We will be engaging with some projects and all in future also. I wish all the best to this Health Odyssey workshop, Clairvoyance 2018, and I wish organizers and TIS Institute all the success. Thank you.
Thank you, sir, for the informative presentation of the great work you oversee in Kerala.